KRLD.
Thanks for staying with us. 11:50. I'm David Rankin. The prayers and well wishes keep flowing in for Arizona Senator John McCain. Now that word has come out, he's in the fight of his life against an aggressive brain tumor. Doctors found it as they did surgery on him for a blood clot behind the eye. Let's get some insight on this from Dr. Rob Dickerman. He is a neurological surgeon at neurotexas.com. He's on the KRLD Newsline. So what is a glioblastoma?
Well, it's unfortunately a highly malignant form and the most malignant form of brain cancer. So when we talk about brain cancer, there's tumors that occur within the cells of the brain, and then there's tumors that spread from other parts of the body to the brain. And in this case, what we're talking about is a primary tumor that started in the cells of the brain.
And this only happened to have discovered it because he had to have this blood clot surgery?
What can happen is glioblastomas actually, particularly after surgery, secrete proteins that increase your clotting factors. So it's a common brain tumor among the neurosurgery field, as well as far as in the public. It's not that common, but we hear about it. Joseph Biden, Vice President Biden's son, died of it as well.
How dangerous is this for someone of Senator McCain's age?
Hey, that's a very good question. Age is there's a scale called a Karnofsky scale where when someone gets a glioblastoma, we can kind of say their prognosis is based on several factors, and age is particularly one of those. And in his case, the prognosis is poor with this diagnosis. With our treatments of radiation and chemotherapy and surgery, we can prolong survival, but we consider the disease itself terminal.
When the doctors are saying they believe they removed all of the tumor tissue during this particular surgery, they have no way of knowing if they really did, though.
That's exactly right. We have technologies increasing, just like iPhones and everything else, and neurosurgery is increasing as well, where we can do labeling during the surgery to ensure we get the best possible borders. Glioblastomas, what a lot of people understand, are unlike pancreatic cancer. Pancreatic cancer is a very aggressive cancer as well. If you catch it in the pancreas, we can remove your whole pancreas and your survival is great. Unfortunately, most of the time they catch it late, right, and it's spread elsewhere. A glioblastoma is a primary brain cancer. We can't remove your whole brain. So inevitably, it'll pop up again. And sometimes they even pop up in multiple sites within the brain, called a multifocal glioblastoma. So removing it in total obviously buys more time, but it's not curative.
The issue came forward that Senator McCain had some troubles vocalizing when he was in the testimony for James Comey when he was testifying to the Senate. Is this a possible explanation for Senator McCain's line of questioning?
It is possible. It's certainly possible. Depending on, the localized speech generally localizes to the left side of the hemisphere on the majority of human beings, but there are right hemisphere dominant where speech can be on the right side, and there's also people that have speech on both sides. So depending on the size of the tumor and the swelling and the area of the speech, it could have affected him for sure.
It's Dr. Rob Dickerman from Neuro, Texas. 11:54 KRLD. Let's check your money.